last speaker, we have Dr. Clement Meseko. He is a research veterinarian and virologist at the Animal Influenza and Transboundary Diseases Department of the National Veterinary Research Institute of VAM, Nigeria. Currently, he is a visiting Fulbright Scholar in the Department of Veterinary Population Medicine at the University of Minnesota College of Veterinary Medicine.
Thank you. Okay. So I'll be talking about designing an influenza A virus surveillance plan and vaccine for swine using a one-health approach. And it's going to be a practical situation and real-life experience from Africa. So, creating some diversity. You need to get to know what is happening in the other parts of the world. And the context of my presentations will mainly be, we introduce what the story is about, and then try to give you an idea of what the futures of pig husbandry and trade looks like in Nigeria. And I will talk about AIV surveillance and diagnosis in country, and then the situation with vaccination in Nigeria on AIV, and then how we could design an AIV vaccination program for an intensive piggery. And then I'll talk about a one-health approach to all this, and the summary and conclusion. And so by way of introduction, pigs are important production animals that have several merits. We know that maybe when it comes to space, for instance, in Nigeria, we still have pastoralists that roam around the country, and it's actually a security situation. And this is because there doesn't seem to be enough space. Cattle are large animals, I know. But if you have, pigs, for instance, you have fewer space, you can easily have them contained. So it has that great advantage. And it also has a greater advantage than maybe poultry, because probably you need more birds to produce the same quantity of meat that pigs may be able to give. So it's really a very important production animal. And I know how important pork is globally. In Asia, in North America, and Africa is trying to catch up. And I know, except if it has changed now, that the most eaten meat in the world is still from pigs. And our pig production, therefore, is substantially contributing to food security and livelihood and economy, most especially even in developing countries. And as we know, with many livestock, viral diseases, including other diseases also, besides viral diseases, but viral diseases of pigs are very many. The one that is killing a lot of pigs in Africa particularly, maybe that's why it's called African swine fever. Probably it's originated from Africa. And so it's ASF, for instance, is doing to pigs what HPAI is doing to poultry. And apart from that, we have pests, we have Japanese encephalitis virus, PED, PCV, and influenza A virus. But all these are not as important as the ASF and swine influenza in Africa just yet. And so talking about the futures of pig husbandry and trade in Nigeria, we're not anywhere near what is happening in Asia and America and Europe, but we have greater than 10 million pigs. But sometimes some of these populations, maybe I have to take it from FAO, which is maybe reliable data. If not, I'll probably say we have more pigs in Africa than is stated. However, Nigeria, where this study is kind of being focused, accounts for over 30% of the total pigs that are being produced in Africa. And these pigs are found in very high density production system, intensive piggery. We have not minding that there are intensive piggery, then we also still have this kind of free-range, loose production systems that are also very important when we consider livelihood, because they contribute to what people kind of depend on for their livelihood, and it contributes to the economy. So we have still free-range pigs, and then we have even pigs that roams around, sometimes some pigs that are not really enclosed, they are not within enclosure, so they roam around. and then fend for themselves. Eventually, they roam back to the house owners, who owns them. But these pigs are still very important to the owners because they are a source of livelihood. And then some practices in Africa that is peculiar is that we have live pig markets, very massive pig markets where people bring their pigs on every market day, maybe 5 days or 7 days for sale. And within all this confinement, there are lots of disease transmission and ecological factors to consider. And so sometimes we have even wild pigs, maybe probably most. Okay, well, what is even important in some countries in Europe now are ASF in wild pig. So I know there are some wild pigs probably in some places in the US also. But in Africa, we do have few places where we have wild pigs. And some of these comes into some kind of interface with even the domestic pigs and kind of complicate some of the disease transmission events. And so this is the map to show you, according to FAO, the density of pigs in Africa. So the place that is circled now is that region that I'm talking about specifically. That's Nigeria. And then it shows the kind of live pig market I tried to explain. So you now have people in thousands and pigs in several thousands all gathered together every week, with the higher chances of transmission of diseases. And then some of these pigs, when they are kind of bought in this market, are now also transported within the country and even outside the country. So there's a transboundary movement of pigs. So whatever is the problem in any of those countries or any of those regions become a major issue for other countries. Now, this is an interesting part. And I don't think there are many places in the world that still has this kind of a situation. This city, it's actually one of the most populated cities in Africa. It is Lagos in Nigeria, where we have over 20 million people living in a city. But the picture that I'm showing now is actually not the city of Lagos, but the city of pig. So you have pig city within a high density city. So, and these are estates that are replicated in many places. So you now have a whole area of pigs surrounded by a whole area of city. And we had sampled pigs in these situations a number of times, and we've been able to detect circulations of H1N1. And then now Nigeria is also peculiar because we've been one of the hotspots for highly pathogenic avian influenza. We've always been having recurring highly pathogenic avian influenza. And because biosecurity is not as good, so the chances of transmission, inter and intraspecies transmission of these viruses is quite common. So we've also sampled some of these pigs and discovered that they are also kind of coming. In circulation is highly pathogenic avian influenza, even in pigs. So you have highly pathogenic avian influenza, you have H1N1, and you have all the other kind of viruses all mixing together within that same scenario. And now, this tried to now kind of show you the peculiarity of that pig city that I showed. The lower picture is the density of that city called Lagos in Nigeria. I mean, people are everywhere. It's highly populated. And up there, you also find now the pig markets I tried to describe. But what is even important now is the picture in the center where, okay, I tried to show a pointer. Okay, the picture in the center is actually, if you can see it from your position, you will notice that the pig city that I tried to show earlier is actually in the center of the city. So you now have massive population of people surrounding a high density pig production system. I mean, what you likely will expect is that there will be a disease transmission to and fro, from either human to pigs and pigs to human. But what we have noticed over time really is that until 2009, influenza in swine was not as important as it is today. And this was because post the pandemic 2009 was when the virus was actually transmitted into human. And so most of the pigs that we say, like the previous speaker said, are actually transmissions from human to pigs. But because that has not really been something that had caught the attention of the government, so there hadn't been an established regulatory policies for vaccination and all that. Even for avian influenza, the country is one of such that had been hesitant in applying vaccination for avian influenza as much as it's causing a lot of trouble. So the option that is preferred is stamping out the population and then hoping that the virus will be kind of eradicated or controlled. But that has really not solved the problem because each year we still have a reintroduction of the virus from Asia through Europe back into Nigeria. So as far as control is concerned, sometimes the biosecurity measure and stamping out works because sometimes when there's another season of reintroduction of the virus is usually different from the previous one that was circulating. So the government is still insisting that maybe biosecurity and stamping out may still be the way to go with respect to highly pathogenic avian influenza. But for influenza in other animals, mammals particularly, equine influenza, we've also had several episodes of equine influenza in Nigeria. And so for equine influenza and swine influenza, the government is kind of more relaxed with respect to vaccination. And therefore, we decide that it may now be reasonable really to determine what kind of vaccine and what kind of virus is circulating that will determine the kind of vaccines that will be used in this production system. Of major concern really is that pork, piggery, is very important because it contributes largely to livelihood and food security. And then we also know that it's a zoonotic disease. So for instance, even when we had the pandemic in 2009, I mean, it was traced to triple reassortance of the virus, avian, human, and even swine, that eventually resulted into a strain that was now transmitted to human. So it's a zoonotic concern, you know, both affecting food security and also threatening public health. So what we try to now do is to imagine that this virus now circulates in both human and animals, and then there will be a need to now design a kind of vaccine that may be able to now protect the pigs from human. Sometimes when we talk about zoonosis, there's this stereotype of thinking it's diseases that are transmitted from animals to human. But of course, definitions are changing now that we now know that it's a bidirectional transmission. But the scenario in Nigeria in this production system, it's that the animals are even more at danger of human. So it is the human that are transmitting the influenza virus to human. I mean, the human that are transmitting the influenza virus to pigs. And so in trying to design a vaccine for influenza in Nigeria, a couple of things that are going to be taken into considerations are even the platforms for vaccine production that has been explained by previous speaker. You know, with respect to either we use a killed vaccine or we use a live attenuated vaccine, or we even use subunit vector vaccines, the different category. And then the third generation of vaccine production now that use the DNA technology. But what is actually important also, like has been emphasized, is the diversity of influenza in swine, you know, because no magic bullet, as we had, you know, so if you must produce a vaccine for pigs, it must be based on a study that determines what are even the virus that is circulating within the head. So this will now require that we do a surveillance that will involve collection of samples and then making some kind of diagnosis and isolating the virus and even doing a full genome sequencing to determine the genetic variabilities. So it is that may now kind of lead us to producing what kind of vaccine. Even if we have to make an autogenous vaccine, then of course it has to be based on isolates within the farm. And then if we now have to do some other third generation vaccines using the DNA technology, then we now have to be sure that the various antigens that are derived from these circulating viruses matches what vaccines that are going to be used for them. It is only then that it could be a bit more effective. And so for swine influenza vaccines, R&D, so we've attempted to maybe probably produce an autogenous vaccine. I mean, that process is still in place. But you know, sometimes even when we try to do a thing back based on our technology, we still have to now kind of, learn from the technology of countries that have done some of these things before and are very good at it. So just learn, kind of do a technology transfer. But now, even with ASF and many other kind of very diseases of high consequences in Africa, it's usually very difficult to transport maybe samples from pigs, for instance. And so we will now be able to make sure that we kind of develop our own capacity for isolation and then be able to isolate from those regions, from those farms, from those countries to develop an autogenous vaccine. And then the other option will now be to kind of do some kind of in silico vaccine design that can now also be able to give us a full understanding of the kind of genetic variabilities in the isolates or in the circulating virus, and then kind of engage some of these companies that are into vaccine production, because sometimes even if those companies, like, so it's usually some of the kind of limitations with vaccine production, particularly for influenza. If any of those companies produce a vaccine, for instance, that is used in Europe or America, it doesn't guarantee that that vaccine will be effective when used in Africa. So we then have to be able to kind of customize those vaccines, and those companies have to be able to customize the vaccine, maybe in cooperation with researchers, and design a vaccine that will be more kind of specific to the need of the country. And so because of that, what we now need to do is to take inventories of circulating AIV in Nigerian swine. So over the years, it has always been consistent. There's always been consistent. There's been H1N1. Occasionally, we pick H3, but 90% of the time, it's H1N1 that is being detected. And then we have data on that. And then the other interesting thing is that most of the countries in Africa where we've had influenza in pigs also, they've had similar experience with what we have in Nigeria, whereas the virus is also transmitted from human to pigs. That has been really dominant. So of all these countries, there has always been a transmission from human to pigs. So that's why humans are the one that is endangering the pigs. And then, unlike America, where we have up to 25 clades of influenza virus, this is actually, there's only one clade so far that we've been able to describe. So it even makes it easier for us to focus our attention on designing a vaccine that's kind of is focused on that clade, and that probably would be more effective. And of the quite a number of vaccine companies that one has been able to, maybe for trade reasons, some of them may not declare the kind of the components of their vaccine. But for some of these companies, at least we can identify with a couple of them that may also be a kind of vaccine that can be used. But like I said earlier, that will not even guarantee efficacy. So it will still have to be that such companies are engaged to produce their vaccine that is tailored to what viruses are circulating in the region. And so a couple of countries have been reporting the swine influenza in their hands, Egypt, Nigeria, Kenya, Tanzania, and even Southern Africa. And the interesting thing is also that they are most of the time H1N1, and they are even a single clade of circulating virus. And the other aspect now is, since we now know that transmission is usually from human to pigs, so we try to now imagine that for the next couple of years, if we monitor the circulating virus in human, that will eventually may be transmitted to pigs. And then, so if we want to design a vaccine, for instance, it may be important that we anticipate what is circulating in the human population, and that will kind of assist in coming up with a design of a vaccine. Now it's like we are going to be protecting the pigs against the human. So when we know what is circulating in human that will likely be transmitted to pigs, then we may want to customize a vaccine that will be administered in the pigs, so that when that virus is transmitted from human, the pigs will be protected. Okay, so this is, don't mind the black space there. What it eventually showed really is that we try to compare the circulating H1N1 in human and the currently circulating H1N1 in pigs, and then try to see their similarity. Because sometimes when these vaccines are produced, the efficacy is also kind of determined by how closely related the virus are. So by this graph, we've been able to actually see that, most of the vaccines are at least 98 or even sometimes 99% homology. So it won't be an error if a vaccine that has, or a virus that is circulating in human and that of pig have as much as 98% homology, then it's kind of gives an indication that there could be a conferment of protection. So we would then get data on the sequences and then consensus sequences, and so make some kind of direct collaboration. And this is where even science becomes interesting. We've been talking about how we can relate more with the industry. So if back in the laboratory we are able to make some kind of deductions based on circulating virus in the region, and then we're also now able to relate with the companies that are producing vaccine, and we share data with respect to what kind of vaccine may be useful for us. And then we have a customized vaccine that is designed for our use. It makes for better efficacy and protection of the pigs. And so in doing that also, we can also apply the same principle to some of these in silico designs of the third generation vaccines, where we collect samples and we'll be able to determine what is currently circulating in pigs, and based on PCR diagnosis and sequencing. And then even if we now need to kind of use those RNA and then create some RNA particles that are now put into vaccine production platform, and eventually we'll have a vaccine, and the same vaccine will be used to vaccinate the pigs. And then it makes a very complete circle, because now the antigen relativity in terms of similarity are going to be preserved. So at every time, we may then need to be kind of checking what is circulating, and it's based on what is circulating that a vaccine can then be designed. And then the one-head approach is such that now that it's established that most of the viruses that the pigs get are from human, then we'll have to then protect the pigs against the human. But interestingly, if we remember that at the beginning of 2009 pandemic, it was said also that the virus that caused the pandemic had an origin in pig. So it's a complete circle, and it makes a lot of one-head sense that if you protect the pigs, you are indirectly also protecting human, and eventually reducing the chances of the emergence of a pandemic. Coronavirus had really dealt with the world, but assuming it was an influenza virus with a higher transmissibility, maybe probably the stories of what happened in 1918 may be what we'll be dealing with. And it's not stopping that these viruses will change soon. The antigenic variations, the drift, the reassortment will keep going, continue. And as long as we allow circulations of influenza, either in the human or in the pig population, the higher chances of replicating and changing and evolving into some strains that may now increase transmission, increase virulence, and may even be more pathogenic. So the time now to prevent the next pandemic is now. And in summary, the institute where I work in the last 100 years have been producing vaccine using the old method. Even now, we still produce some vaccines for Newcastle disease using inoculation in embryonated egg. It's efficacious, and it's kind of, and the technology is still working, but, gradually there are other technologies that are emerging that we probably will need to take advantage of those, and that is with respect to even the third generation vaccines. So we've been producing vaccines, and we have a lot of vaccines that are being produced using this technology. Even before then, maybe in the century, back in the century, there were productions that were based on even a whole organism inactivated, So things are gradually evolving. So the interesting aspect will now be for us to take advantage of technologies that is evolving, and then also now maybe start to use this third generation vaccine production platform, and at the end of the day, maybe it could even cost less for those that are producing it, and it could also I mean, make means of profit margin may be higher, you know. And then to us, even as scientists, we know that it's easier, it is safer, you know, to use a subunit vaccine, for instance, than a whole organism vaccine, so that the chances of maybe kind of reversion to virulence, or chances of when you try to even inactivate and you don't have a proper activation of the virus, and so many other safety issues will be reduced, and then even for efficiency of production. So that is why if technologies like this are kind of are taken from developed countries and are introduced into countries that are developing, it really makes a lot of sense for global health security. Because sometimes, even like we say now, I know there's been a lot of talk about African swine fever risk and attempt to make sure that it doesn't come over to America. But there would have been less anxiety if there was no African swine fever in the first place, you know. So that also applies to a number of other pathogens. So if we can control disease globally, it makes the world a safer place. So I'd like to thank the persons, Professor Marie Montse, and Dr. Miriam back in my country, and then every other person in the Department of Swine Population Medicine who are in this picture for hosting me in the last 9 months, and I'm thanking all of you for listening to me. Thank you.